Thank you very much, sir. We have a comment from Kwesi. The commissioner is going to be on the panel, so I'm sure he'll have time to address that.
Thank you so much. My name is Kwesi Patrick, a journalist at NBS Next Media. But I don't know if this is a question the panelists will answer. I'm seeing they are focusing on Lake Victoria. I grew up in western part of Uganda, Fort Potro, being one of the best swimmers in my school, Nyakasura School, because we have the biggest crater lakes. How are we going to extend also ways of preventing drowning? Because actually yesterday, 2 days ago, we had a woman drown at Lake Bunyonyi. You see, just because of negligence. How are we also trying to extend, apart from Lake Victoria, extend help to the crater lakes? We have the biggest crater lakes in Fort Portal. Yeah. Thank you.
Thank you, Kwesi. All right, I'll take one more in this table, then we can go into our panel discussion. But if you do have comments, questions, there are notepads on your table, so we can write those down and we can pass them to the front during the discussion. Thank you.
Thank you very much. Maybe I should stand up. My name is Norman Gwebayanga. I'm from the Ministry of Works and Transport, specifically the Maritime Administration Department that deals with safety on water transport. I moved with my Assistant Commissioner for Safety of Navigation and Training, and I'm sure he will give an elaborate view on a number of aspects that have been aired on the documentary, but I just thought that I would highlight a few things. As the Ministry of Works and Transport, we are doing quite a number of things that have been aired on the documentary. We do a lot of safety awareness campaigns on waters. And we teach people what the qualities of a good life jacket is. We are also very much aware that there are a number of counterfeit life jackets on market. And indeed, during our search and rescue operations with the Marine Police and the UPDF, we happened to have at a time, one of the operations, we retrieved a body with a life jacket. It clearly tells that the market is infiltrated with a number of counterfeit life jackets. The Ministry of Works, in conjunction with the UNBS, the URA, and UMA, Uganda Manufacturers Association, we are drafting principles to have quality and cheap life jackets on market. But also, as the national coordinator of the multinational Lake Victoria Maritime Communication and Transport Project, the Ministry of Works is doing quite a number of things, among which we have constructed 9 search and rescue centers around the water bodies of the country. And on these search and rescue centers, we are instilling 9 search and rescue high-fast boats to be able to respond to most of these emergencies. I'm speaking this because I've seen most of the emergencies that have been aired in this documentary are transport-related, so I couldn't go without mention. We have also installed 9 weather buoys, meteorological buoys, which we have handed over a software, the Ministry of Water, to enable the country and the water users or the seafarers to get timely updates of what happens on the waters of the country. Me and my commission and the Ministry of Works, we are drafting regulations and we are developing boat standards, boat building standards. And these are before the Parliamentary Council, if I'm to be very sure. We have aids to navigation around the water, definitely, that help our seafarers to maneuver the waters. Most importantly, we have upgraded the former Fisheries Training Institute into a Marine Survival Training Institute with a sophisticated training pool that exposes a seafarer to different conditions of the lake. So we expect that with time, we have seafarers that shall be trained in order to get to know how to maneuver over water bodies in case they are using them. We have drafted MOUs with different agencies, including the Ministry of Health, including the Ministry of, the MODVA, Ministry of Defense and Veteran Affairs, to help us carry out search and rescue operations. And indeed, we have created a search and rescue data resource that includes, among others, because you know you cannot carry out a search and rescue operation single-handedly. Ministry of Health has over 14 ambulances, which we believe can be very good in responding to search and rescue emergencies. Finally, but not least, the Uganda National Roads Authority, which is now under the Ministry of Works and Transport, already has existing search and rescue high fast speed boats, which we have put in our database. So generally, we have enhanced our search and rescue system, and we hope that it will serve as a very, very, very big step towards saving the number of lives that drown on waters of the country. Thank you so very much.
Thank you very much for that. And I think what that re-echoes is that all these interventions and what we're doing towards drowning prevention call for a multi-sectoral collaboration, which is just proof that we all have to work together. The Maritime has a part to play, the organizations have a part to play, Ministry of Health, Ministry of Water and Environment. So we're all here for that rallying call that we're coming together and we're coming up with solutions that work. All right, thank you for that. Like I said, we don't want to lock anyone out, but let's close that session for now. If you do have comments, write them down. There are notebooks on your table. If you don't have, just let us know. We'll assist you. So right now, we'd like to go to the panel discussion. Before that, allow me to recognize Mr. Rozije Charles, the Assistant Commissioner, Safety of Navigation and Training, Ministry of Works and Transport. I'd also like to recognize our partners from the Police Marine Headquarters, IP Sanyu Stephen, AIP Echo Person Milton, ASP Kasuji William, and IP Makoka Vincent. Thank you very much for joining us today. So a round of applause for our guests and also for yourselves for being a part of this. Like we said, anyone can. No one? Let's say that again with energy. We just had some breakfast. Anyone? No one? Thank you very much. So to go to our panel discussion, I'm going to invite Canary. Man, I had so many questions for him, but now he's a moderator, so we'll see. I'd like to invite Canary Mugume, an investigative journalist, renowned and news anchor with NBS. He was also behind this documentary. Kindly give him a clap as he comes to the front. Would like to also invite our Commissioner Sowet Sewegude, the Department of International and Transboundary Water Affairs, Ministry of Water and Environment. A round of applause, please. Ms. Navidye Allen Jaria, the District Education Officer, Mayuge District. Is she here? Is Belinda, where is Belinda? He's outside. All right, is Mr. Lawrence Okoth here? Mr. Lawrence Okoth? Yes, Mr. Lawrence Okoth is a Director, Design, Innovation, Communications, Design Without Borders. Let's give him a hand. Thank you very, very much. Can somebody call for me Belinda if you see him out there? All right. Miss Navidye, we have been waiting for you. It's so good to have you. Let's give her a hand as she comes to the front. Miss Navidye is a District Education Officer, Mayuge District. She'll be joining our panelists. All right, thank you. And Emmanuel Belinda is the manager, the Drowning Prevention Project with Reach a Hand Uganda. Let's give him a round of applause as well. So, Kanari, over to you. Thank you.
Thank you very much, Linda. Good morning to everyone. Thank you for being here at the mega premiere of the Unpredictable Waters. Just before I came on stage, Patrick there shared a story. This was done 2 days ago. Police in Kampala are investigating the circumstances surrounding the drowning death of a 27-year-old woman in Lake Bunyonyi on Saturday night. The incident occurred on 1st February at approximately 9 p.m. on the islands of Lake Bunyonyi located in Kitumba sub-county. So, this is an occurrence that happens almost every day. But like the commissioner said, it only makes news when it involves people with influence. So allow me begin with this. I'm not here not just as a maker of the documentary, but I'm also here to share my trauma. While I got onto the boat to the islands of Mayuge district, while I was enjoying the waters and, I reached the island, of course, heartbreaking stories that did not leave me the same. Towards 6 p.m., me and the team from Sauti, is Lynn here? Okay, but I can see some team from Sauti that I was with. It was approaching 6 p.m. We had left one island and went to another. The LC of the first island called Simwe. The island is called Simwe. Called and said, "Are you guys still there?" He said, "Yes." He said, "You do not know what you're up to. You need to leave now." "But what's the problem? We're still filming. We can, He said, "Yes, but you see, traveling on the lake is not entirely up to you. It's entirely up to the lake. When it gets cold and the waves start changing, you might as well spend the night on the lake, or rather on the island." So as much as we wanted to get more stories, we had to leave immediately. When we left, in the middle of the lake, I've forgotten the name they use, the drive of the boat is called what? Not chauffeur, there's another word they use. Yes. Said that the fuel of the engine was almost depleted in the middle of the lake. Should have seen our faces. And indeed, the waves changed in the middle of the lake. One person who we had given a lift from the island, traveling to the mainland, said, "By the way, I hope you guys know that those life jackets are not up to standard." So why are we putting them on? Said, "Well, these are just a resemblance of what life jackets should be, but this is not the actual standard." So it's actually highlighted in the documentary when I talk about standards of the life jackets. You're supposed to wear a life jacket that is up to standard, functional, but also can carry your weight. It's not that whichever life jacket you find on the boat, you should put it on. It should be able to match your weight. So anyway, we are in the middle of the lake. It's getting dark. The waves have changed. Now we know the life jackets we're wearing are not up to standard. And the guy is telling us the fuel is almost done. We have about maybe 15 minutes to reach the mainland. Anyway, I don't know how the guy did it, but I think he would drive so fast and then leave the boat to go by itself. It's like driving the car in neutral, so you don't spend fuel. That was a trauma. It's laughable, but me who got onto the boat, traveling to the island and enjoying the waves and taking pictures, so it was me holding onto my phone like this, knowing I'm putting on a life jacket that is not up to standard. So I just thought that I should share that. And I was with some people, and once we got onto the mainland, that's when we remembered to praise the Lord and all these other things. So when we first set out to make this documentary, I thought we were documenting a crisis. I didn't realize that we would be documenting grief, desperation, and the painful choices that no human being should ever have to make. You lose your first child to drowning, a 4 months baby drowns while you're seeing. Because you have to save yourself first, the baby the waters swallow the baby. A year later, because of the trauma, you don't want to get onto the lake because it's not safe. The child dies in your hands because you cannot get onto the lake because the waves have changed. So I just thought I should share that experience before we get into the panel discussion for context. Let me begin with Commissioner Sowed. Recent reports indicate that Uganda has one of the highest drowning rates globally, with over 3,000 deaths annually. 3,000 deaths annually. I don't know, I'll get into the statistics maybe at a later point and see what disease in Uganda kills 3,000 people annually. That's big. Given your role, Commissioner, what specific policy measures is the ministry implementing to address this alarming statistic?
Yeah, thank you, Canary, for sharing your experience on the lake. And indeed, you testify that this is a challenging situation, but also that drowning can easily happen, even when you least expect it. So we need to be prepared in the event that one is faced with that situation, then they know what to do. And as government, at the moment we've not developed a policy specifically that's addressing drowning, but we have a number of policy interventions that we are already undertaking. As I mentioned in my remarks, that we've developed what we call the National Water Safety and Drowning Prevention Strategy that identifies a number of interventions that need to be done or undertaken to make sure that we address the challenges of drowning. And my colleague from Ministry of Works has also elaborated, for example, what Ministry of Works they are doing, and that's one of the policy interventions that government is taking. That is preparing projects that address the different aspects of drowning or try to support the drowning prevention initiative. That's one project that is being implemented by Ministry of Works, which is the Multinational Lake Victoria Maritime Communication and Transport Project. It's basically looking at Lake Victoria, but also Lake Choga and Lake Albert. I think one of the participants mentioned that we are concentrating on Lake Victoria, but no, we are not concentrating on Lake Victoria alone, but also other lakes. But as we're starting out, we may not cover all the water bodies, but that is the strategy that we're implementing. Now, as part of that project, we've already worked with the telecommunication companies to make sure that they allocate a code, okay, that one can call in times of distress. And this is 110. So when you call 110, then you'll be able to get a help. That call is usually routed to the Maritime Search and Rescue Center that is currently being constructed in Entebbe, but also we coordinate with the other countries, for example, Tanzania, as well as Kenya, where we've constructed the regional maritime search and rescue center. So if you're, for example, in the Kenyan waters, but you're having a Ugandan SIM, you can call this code, but will still be routed to the relevant center where you can quickly receive help. We've also just launched a project on drowning prevention, spearheaded by Richard Han, which is actually supporting this initiative of the documentary, but it's basically looking at awareness creation and also teaching school-going children some swimming skills or basic skills that one can use when they are in this kind of situation. So these are the projects that we are pushing as government to make sure that we handle or tackle this challenge. As part of the strategy costs about 25 billion Uganda shillings for the next 5 years. But so far we've identified 11 billion to start implementing that strategy. And part of the project is the resources that have been allocated in these projects are part of the resources that have been identified. So we basically have a gap of about 14 billion Uganda shillings. The Honorable Member of Parliament asked what gap do we have in terms of addressing this challenge. So 11 billion is still a gap that we need to close to make sure this strategy is implemented. I mentioned about awareness creation, but also data collection and research, because we believe that to have more effective interventions, we need to know where this problem happens or where it frequently occurs, and then what interventions are there, and then the gaps. So through the research, for example, is what helped to inform the strategy that we prepared. And we continue undertaking this to make sure that we have the adequate data to see whether the strategy is being implemented or achieving its intended objectives. So with those, I think I can stop there and give opportunity to others.
Thank you. While filming this documentary, the parents on the islands told me that you cannot risk the children. Well, some do, if they don't have options, crossing the lake every day to go to school. So what happens is you have to get a friend or a relative on the mainland so the children can stay with this person during school time, because they can't crisscross every day. When they don't have options, like they don't have that person to stay with the children, they have to cross every day. And that, sometimes, you have to wait for the lake to cross. It can become at 1 p.m. It means that you've missed class the half a day. Nabia Allen here is the district education officer for Mayuge district. And Mayuge district, particularly, why we chose to film from there to show the crisis, has been identified as having the highest rate of drowning incidents in Uganda, with an estimated 24.3 drownings per 100,000 population annually. How is the education sector in your district addressing this issue among school-aged children?
Thank you so much, moderator. Good morning to you all. Greetings from Mayuge District Local Government. Yes, Mayuge District Local Government has various education institutions on the islands and along the shores. And water, the lake being the main source of water for those schools along the lake shores, and then the islands. Even those that are not on the islands still face the same challenge. There are 7 government-aided primary schools with no secondary school in the island sub-county of Jagos, and 1 island has no school, that is Simwe. So they cross from Simwe to Kaza Island on daily basis to access primary education. Then all do not have access to secondary education. So if they are to access it, then the next sub-county, which is the Wanda Town Council, also doesn't have a secondary school. So they have to move to Malongo sub-county, where there is a government-aided school, which is Malongo Senior Secondary School. How has the district, and in particular education, addressed this with these challenges? At the moment, I'll not say that we have any intervention, because like I've earlier told you about the institutions, it's by government policy. Policy is very clear that every parish has a primary school, irrespective of its population and size. So every island is a parish. And where they do not have, and we're enforcing every child should access education, ours is to mobilize the learners to and the parents to access education and continue praying to God to swim if they can really access education. It's of recent that we received partnership from Richer Hand that volunteered to train the community and then the learners in skills of swimming, such that swimming classes are for all children, and then every person is safe to access water with safety. So as a local government, we've not yet put up any remedy as per the challenge.
In the room, how many of us know how to swim? Okay, about a quarter. I learned some years ago to float on the shallow ends. My trauma now reminds me every day how I need to go to swim, but also take my two sons to start to learn how to swim as fast as possible, because that can be a crisis. One of the things about Simwe Island that Ms. Navide is talking about, Simwe has no school, Simwe has no pharmacy or hospital. Simwe has a population of 282 people. It used to be more than 350, I think. That population has swindled due to drowning. Now it has a population of 282 people. Every year they lose people. Simwe has no pit latrine. I know what's on your mind, so how do they ease themselves? In the same waters that they drown in. Simwe has no, it's there. But that's the reality of some of the communities. Let me get to Emma. Emma, as Richer Hand, why did you think that this initiative is very important, that you should shed a spotlight on it to bring it to the center stage on drowning prevention?
Yes, thank you so much, Canary, for the opportunity to speak to our congregation. Yes, I think it is very important. As we all know, drowning is one of the public health problems we have, and it is indeed a silent killer. Most of the deaths that happen in this country, in the water bodies that we have, lakes, rivers, among others, most of the drowning deaths are not being captured well, and even if they are captured, there could be some sort of repetitive capturing of this information. So we don't have the exact deaths, or we don't have the exact burden, data-wise, that speaks to drowning. So, as we said earlier on, as we were starting this documentary, it's only after someone who is in a position of power, possibly, when one of the people close to them has been affected, that's when this problem comes out. But for most of our people on ground, our local people, who would want to refer to Omuntu in case they're affected by this, it may not come to light. But then also, drowning in itself happens in quite a number of, I would want to call them disciplines. When you go to recreation, we have water, there have been uses of water, so in recreation, it's there. In transport, it's there. In the education sector, children use water bodies as they're crossing to their schools. It is there. In sports, it is there. We have quite a number of games which are all played in water. So drowning really cuts across most of the sectors that we have and can affect anyone at any point in time. So because of this, and also Uganda being a third world country, I'm happy God blessed us with freshwater lakes that we have in Africa, but also in Uganda. But these can also be a problem because drowning can happen. So because of this, it is important that we train our people, especially the young generation, so that we can create a water smart generation, but also to instill the skill of swimming, or just basically survival swimming among these individuals so that they're able to survive. Usually, swimming is looked at as a skill or as something that is done by the rich people. I think this is really obvious and true because of access to swimming pools, the costs involved in going to a swimming pool. You will have to pay for the use of the place. You will have to have the gear that you're supposed to have, the equipment that may need to use to learn how to swim, the coaches that you pay to learn how to swim. So in the long run, this becomes a skill that is going to be learned only by those who have access to these kind of resources and places where they can train from how to swim. So it leaves our people in the communities unattended to, and therefore they don't have this skill. So as reach a hand, it was important for us to notice this and see that our people are really suffering in the communities. And School of Public Health really did research, and we have the data. This is all based off the data that was collected by School of Public Health. So we are doing this project to ensure that we train individuals in the communities, both those in school and those out of school, how to swim. They get the basic knowledge, first aid, how to survive in water, the skills they need, for example, the meteorological information. They can learn about the lake, the weather, and read all those things, and not move in the night, know the remedies to prevent drowning, so that we can save our population and our people in general. Thank you.
Thank you, Emma. I did not interface with drowning while I was filming this documentary. It was not the first time. First interface with drowning many years ago when I was in primary school in Bara. We used to leave school, cut class, go straight to a river called River Rizi and start to swim. The community around River Rizi was an Indian community, and they would cremate. When someone dies, instead of burying them the normal way, they would burn and then, of course, throw the ash in the river because it was flowing. So we'd cut class and then go to River Rizi to swim. But my friends and kids at school would drown. Almost every week would have a kid drowning. But they would not say that they have drowned. They would say that the ghosts of the Indians whose ashes were poured into the lake have taken them. So there are myths around drowning, I think, that we also need to start addressing. Every time a kid would drown, they'll say the ghosts have taken them. But it's because they just enjoyed the water and they did not know how to swim. I should have learned how to swim many years ago, but like Emma said, it was always looked at as a privilege for the rich kids because they have access to swimming pools. So maybe we also need to, and talking about approaches, Okoth, as a design innovator, how can human-centered design approaches be utilized to develop effective drowning prevention tools and strategies tailored to Uganda's context?
Thank you very much, Canary, and thank you to Rahul for organizing this event. So yes, maybe just to give a bit of an introduction. Design Without Borders does product and service design, and yes, one of the methodologies that governs how we work is the human-centered design process. So this process is a lot of words to basically mean that what we do is work directly with the communities to develop the products and services that we present. And that's exactly the same process that we are using with what we are calling the Enhancing Fisherfolk Safety Project, with focus areas including Mayuge, Rakai, Masaka, Soroti, Serere, and Jotera. So about 6 districts. This is a process that we've applied across several projects over the last 23 years. And life jackets are just one of those projects. We have 2 life jacket projects that we've done so far. One was completed in 2006 using the same process, but challenges at the time slowed down the implementation of the project. And that's something that we are trying to avoid in the project that we are currently doing. But just to say very specifically, the human-centered design process, because you're working directly with the community and understanding their challenges, inviting them to participate in the process of developing the interventions. In that way, we start to see ideas that the design team on its own might have not noticed. And so now we are hearing, I think there's solutions that we already found on the ground. For instance, there is a log, there's a tree, and I think the Marine Police probably know about some of these interventions that the fishers are using. Some materials that they've found to be buoyant are what they're using to create rafts that they can use to cross the lake. In some cases, in some regions of the lake where the distance is not that long. Of course, people are trying to improvise with jerry cans, for instance. Of course, jerry cans of a certain number of liters provide a certain amount of buoyancy. And so they've decided that they can also use some of these jerry cans, combine them in certain ways, and use them as flotation devices. So these existing solutions in the human-centered design process give us an idea of what direction we can go with our own interventions. And of course, you do have the challenge of having to provide an alternative to also counterfeit life jackets. I think the current life jacket on the market costs 30 to 35,000 shillings. And that life jacket provides buoyancy of only a few minutes to maybe an hour at most. So these have to be taken off the market and replaced with jackets that can provide up to 5 hours, 7 hours, maybe even 12 hours of buoyancy. But for us to develop those solutions, we need to listen to the communities through the human-centered design process, understanding what they think might work for their situation, also in terms of cost, in order to develop a life jacket that can suit their limitations in terms of cost, as well as, I guess, instances of use and how they currently use their alternatives at the moment.
Thank you, Okoth. I'll just go through one round of questions and then we get down to this panel discussion, maybe throw it to the audience. I've seen how we love to be on the water, celebrating birthday parties, marriage proposals, anniversaries. And when you're getting onto the boat, they give you the life jacket in the middle of the lake where it's most dangerous, where you most need it. You take it off because it has ruined your outfit. I think that we need to be extremely careful. One, understand the jackets, life jackets with standards. I didn't know that, for example, you also need a jacket that can give you more buoyancy in terms of time. 3 hours, 7 hours, I didn't know the difference. I think there's still a very big gap of information that needs to be addressed. But of course, let me stay with you a little bit. Can you, not everyone might be familiar with the work Design Without Borders is doing. So can you share some examples of design interventions that have successfully addressed public health challenges and how similar methodologies can be applied to drowning prevention?
Yes, thank you. I mean, like I said, we've been working over the last 23 years developing various solutions. So we have products that were developed also across different contexts. We have work that we've done in Uganda, in Bangladesh, in Tanzania, Benin, all over the globe. Those have included wheelchairs that improved access, of course, for people with disabilities, but were designed in a way that makes it easier for the wheelchair user to sort of maneuver the movement of the wheelchair. There's so many details there that I can't explain in this moment. But more specifically within Uganda, we worked with the Makerere School of Public Health and specifically Dr. Oporia's team to develop interventions that were aimed at reducing injury to children under 5 years old in informal settlements. So we developed interventions that were tied to reducing the likelihood that the child will get burnt while their guardian is cooking, for instance. Interventions that reduce the chances that the child will come across poisonous substances, specifically medicine. Instances like sharp objects, cutting kids, were also reduced by some of the interventions that we developed for that specific project. Many of them are on our website. I'd encourage each of us to have a look at some of those interventions.
Thank you. To you, Emma, Commissioner Swede, you'll have the last word on the panel. To you, Emma, you have developed the data, you've gathered it. How do we make sure that we use this data to then, one, create understanding of the crisis, but two, create solutions?
Yes, thank you so much, Canary. So, as the world is evolving, we understand that data is one of the most important things we have in the country or in the world. It points you to the right direction of where you have to be working. For example, identification of hotspots, especially in the implementation districts and among other places where there is water. So we can purpose to use this data to put up interventions in these areas which are hotspots where drowning occurs often, to reach out to our people, put interventions, awareness, to create awareness in there, training for the people in and out of school, and ensure that they have the skill for swimming. But also, beyond these areas, anyone can be affected by drowning, not only those who are staying in places where there is water. So we can purpose to have trainings, possibly have the education system incorporate drowning prevention and also information around water safety in the curriculums that we're using in the schools. So pass this through the Ministry of Education and Sports to have all the individuals who are below primary at least learn this information. But also to mention, using this data and the information we have, we know this is a multi-sectoral kind of problem. So we need all hands on deck. We need to work with all the stakeholders, all the partners, all the ministries, all the individuals working in drowning prevention to ensure that we have a united stand and we can reach out to our communities, support them, teach them, and learn from each other moving forward to ensure that we use this data well.
Thank you. Alan, in your opinion, what role can integrating water safety education into the school curriculum play in mitigating drowning risks amongst pupils and students?
Thank you so much.
I said Alan.
Okay. Thank you so much. Integrating drowning prevention in the curriculum can play a very big role because one, teachers are learners, and when they are teaching it and also demonstrate, they get the skill. Then learners are changing agents. When they are trained in the same, they go and cascade at home so the community can easily also change. This can help a big community to get the skill in a very short time, because drowning is not for only children in school and those out of school, but then for every person that accesses water. But still, it's prayer that if it's incorporated into the curriculum, then many will know that it is a challenge, because before that, we didn't attach value to it, that it was really a challenge. And it's like we were saying, those in the islands have challenges of not accessing education. Little do we know that they are really having issues because they are losing their dear ones on a daily basis. Still, would pray, much as they incorporate in the curriculum, if the policy would also be looked into, that maybe institutions that are really in hard-to-reach areas, especially on the waters, should be made boarding, such that the daily transit to reduce on the risks is at least taken care of. And with, when you look at our policy of one school per sub-county, and this is a whole sub-county without a secondary school, and it will get a city school, which is actually also day, because we are saying no illegal collections in any institutions. The first question was, what the local government has done. We could not tell the people to have children in boarding because it's against the policy. So if it comes out as a policy that city schools on islands should be boarding, say that all these learners are collected from the various islands and at least settled in one island that has a city school, then at least come once and then leave at the end of the term. That one would also address the same. Then also schools along the lake shores should be taken in the same manner, because like you say, they don't have pit latrine. It's true, even those that are on the mainland, but along the lake shores, communities, the lake communities use the same facilities with the institutions. For example, the school of wonder that you visited, every term, we ought to give it a latrine, because the communities use it. If not, then we shall have open defecation, which is also a challenge. So if we could, the policy could also come in that and then address those other areas quite differently from how we are implementing the policy on other parts of the mainland.
Thank you. And lastly, Commissioner Sowed, areas for collaboration, given our transboundary nature of many of our water bodies like Victoria or even Albert, what are the areas of collaboration with our neighboring countries?
Thank you, Canary. Actually, I alluded to those areas, particularly the ones that we are collaborating on Lake Victoria, the search and rescue efforts that are being implemented by the 3 partner states, that is Kenya, Uganda, and Tanzania. We already have the infrastructure, but we need to operationalize and make sure that these facilities are functional. And there's a coverage gap that the 3 countries are trying to work on. Currently for Uganda, for example, we're having a coverage of 30% of the network on the lake. So if you're in deeper waters and you call the code that I mentioned, the 110, you may not be able to go through. So there's need basically to increase the coverage to make sure the entire lake, not only in Uganda, but entire East Africa, Lake Victoria is covered. And the same applies to Lake George, Lake Edward and Lake Albert that we share between Uganda and DRC. So the other area is basically to harmonize our policies to make sure that actually we have the same standards, so that when one is in Ugandan waters, they are not arrested for using substandard gear or water safety equipment. So those are the areas of collaboration that we are trying to work on to make sure that we address the challenges of drowning on our shared water bodies.
Thank you. Of course, one of the biggest challenges that we experienced on the lake was, like I said earlier, the guy saying that fuel is about to get done. Of course, what I had in mind is called the mainland. They sent us a boat with fuel. We sorted the problem. Did we have network? I don't know. From then, on water, I think I'll give it some time till I learn proper swimming, like an expert. I'll give the audience chance, maybe 2 comments, because we're out of time. So, okay.
Maritime Organization, IMO, which is a body responsible for coordinating all maritime affairs, globally, sent a technical team to Uganda to investigate that incident of the sinking of the MV Kabalega. Unfortunately, when they arrived from that time, we have moved on as a department under the ministry, and now we were able, department under the ministry, and now we were able to come. The department and the ministry have a lot of interventions. If you had time to interact with the department, it is headed by a commissioner, and we have several interventions as our colleague from the Ministry of Water, so Wed is putting it out. The project is ongoing, and it has several components. Components of capacity building, components of providing rescue services, components of providing safety equipments, and even including the expansion of network coverage on our water bodies. This one we are doing in conjunction with the Minister of ICT, Minister of Information. That the problem we have is when people out there, some areas are not covered. Communication is not available. So we are providing capacity to have coverage for communication extended inside the water bodies so that whoever is under distress on the water bodies can quickly be able to do what? To communicate to the shore. And with that, we have created a call center, which is in Entebbe, with a code of 311, where every person who calls 311 is able to be rescued, or mechanisms to have this person reached can be made. This is the first intervention we have done. As the project is going forward, for sure, the boats, the rescue boats, and other equipment too for intervention. But before we move on to all this, in the documentary I've seen something very, very critical. The John Bosco initiative of training and emphasizing putting on life jackets. One of the things that water, actually, may I would tell you, water is the safest transport modes if all the safety measures, precautions are taken care of. One thing is that people have not been sensitized enough to put on life jackets. Life jackets are a savior to life on the water. If any event happens on the water and you have a life jacket, the chances of surviving are like over 90%. But the problem, all the boats I have seen in the documentary, people are just moving around without putting on life jackets, despite the efforts we have put in to make sure that we emphasize this. We work with other organs like the Marine Police, who are supposed to enforce the laws. That no boat should move from one point to another when they have not fulfilled the requirements of safety. And life jackets is number one. But if you see our boats still moving from one place to another without life jackets, that of course is suicide. In the event of anything, you don't survive. So I think we should work together and continue working together as a team from the civil society, the enforcement bodies, to make sure that our people who move on the water take precautions, safety precautions, as a matter of urgency. Short of that, we will not stop seeing people drowning. We work with other organs like CAA. This is Civil Aviation Authority, because they are equally, involved in these rescue maneuvers. And I don't know if they are here today, but they are equally our partners in ensuring that we sensitize people in whatever is required when they move on the water. We have tried to put a lot of interventions in place. Like Bunyonyi, when you started, you talked of somebody who has drowned in Bunyonyi, Lake Bunyonyi, and we are putting up a boat. I think this boat will be coming in soon to support the people traveling on Lake Bunyonyi. Some of these boats, of course, have very poor standards. Our regulations, once they come into force, we shall make sure that all boats operating are seaworthy. A seaworthy boat is a safe boat. But the biggest problem is boats that are moving all around are not inspected, are not certified, are not being operated by skilled skippers or coxswains. So all these programs are already under arrangements to make sure that the people who man the boats are trained, to make sure that standards of the boats are well maintained in terms of seaworthiness, to make sure that all other requirements, safety requirements, life jacket, everything else is in place. Before the boat moves from one place to another, it must have fulfilled the safety requirements. I wanted to submit this.
Thank you.
If there is anything.
Thank you, Assistant Commissioner. Linda, I'll let you manage the rest of the time. I've gotten strong warnings about my time that it's done, so I'll let you manage the rest of the time. Let me throw it to you.
Thank you, Canary. I know we have burning questions. I'll allow just one more. Do we have a lady with a comment? Yes, Lizzo over here, just for balance.
But if they can use 1 minute each, I think we can share the time. Share the
All
5
right.
minutes left.
All right.
Okay, thank you very much. Good morning, colleagues. My name is Enid Mbabazi. I am a doctor. I work with the Office of the Prime Minister, but I'm also a board member, chairperson board of RAHU. And my apologies, I came late. To the question, it's not a question, it's something that we need to reflect on as we deliberate. Colleagues have talked about policies, they have talked about strategies, they have talked about interventions. But we all know our country. We are very good at drafting policies and all these other documents, frameworks. But when it comes to implementation, that's where we go wrong. And drowning as old as, human being has existed. But when I listen to our colleagues, most of these interventions have just been put in place. I think the critical issue now should be around, enforcement and also making sure that these interventions are up to scale. The documentary was focusing on Mayuge, yes, because Mayuge has the most cases of drowning, but we also know that we have issues with the data. And from what has been talked about, I've not heard anyone say that we have a routine surveillance system that is able to give us data on a daily regarding the issue at hand, the issue of drowning. So from my perspective, I think we need to bang the tables. We need to make sure that we popularize this issue of drowning so that everyone knows that it is indeed an issue. I'll give you an example. As a country, we are still grappling with malaria. We have had a lot of interventions in place, but they are not up to scale. We are still struggling with malaria. It's still killing people. Tuberculosis and so many other conditions. So I think we need to make everyone aware, the policymakers, the affected communities, and also we need to look at water as a means of transport, but also water as a source of livelihood. We are focusing on lakes, but there are water bodies. There are swamps where people are dying on a daily. I will tell you in the villages where I'm born, I grew up grazing goats, but also going to these bitogo. As a source of livelihood, we used to make carpets, baskets, and what, and people are perishing there, and we are focusing on water bodies. So until we understand this whole thing of drowning, and then make sure that everyone gets to know that indeed it is an issue, whether they are policymakers, whether they are implementers, policy implementers, whether they are communities, they need to know. And lastly, we need to look at things like, somebody talked about integration, the district education officer, Mayuge, integrating interventions in the school curriculum. We know we have issues with the curriculum, so that will not be like a bullet, but it is something that we can do. But also we can mainstream drowning interventions into other government programs. And also, right now government is implementing the parish development model. That is something that we can ride on because it is at the grassroots and we know that's where the problem is. So I've talked about many things, but the point is we need to let people know that drowning is a problem, right from the policymakers up to the people who are affected. And then we need to put up interventions that cover each and every, should I say, potential areas of risk to drowning, and also make sure that enforcement or implementation of our interventions is addressed. Thank you very much.
Thank you, Dr. Enid. Let's hear one person from that table.
Thank you. Good morning, everybody. My name is I'm Robert Kasolo. I represent a constituency called Ikiki County, Budaka District. I happen to be the vice chairman of PAFROS, that's the Parliamentary Forum on Road Safety and Water Safety. And I'm happy that today we are reaping the fruits. I also participated to see that the maritime law, which is in place, I was part of it entirely. I know it can't be very close. It's a very technical law, but we did all that to see that at that time there was an issue to address drowning and so forth on our waters. Now, much as the lot is being done, I just want to say something. Is that the civil society and the agencies responsible for the drowning, we had a bigger problem during the road safety. There were many players, there were issues, but I'm happy that the commissioner responsible managed to put them together, and now they are moving together. Similarly, the commissioner responsible for maritime administration and so forth should also do the same kind of arrangement to make sure that if we are to move a step, we need to move together, move in a coordinated manner if we are to achieve the intended objectives. Of recent, as Parliamentary Forum, we predicted this, and I had to write to the Prime Minister to guide, as a leader of government business, the agency responsible to coordinate this. And the Minister of the Prime Minister guided that the Minister of Works will be the leading agency. I wrote that letter to guide, because he's the one responsible for that. Now, if we are to handle this issue, we need to be coordinated. I'm very grateful for all the efforts we are after seeing that Ugandans are safe on the waters. So let's work together as a team to make sure we really fight this vice. I'm grateful. Thank you so much. God bless you.
Thank you, Honorable Kasolo. I'd like to acknowledge the presence of other MPs also in the House. We have Honorable Sebikali Joel from Ntwetwe constituency. We have Dr. Biakatonda Abdul, a workers representative, Honorable Mouma Milton from Chigulu constituency, Chigulu South, Honorable Mujungu Thembo from Busongora South, Honorable Nanyondo Veronica, you're very welcome, from Komansimbi constituency, Honorable Chen Peter from Kole South constituency, and Honorable Etuka Isaac from Upper Madi County. It is an honor to have you here. Let's give them a round of applause. It's good to see we have the support of Parliament backing the work that we're doing here and what we're starting, a rallying call. We had one comment from the other table, Lizo. And then would want to hear from our chief guest, who's speaking on behalf of the Honorable Minister for the Minister of State for Water, Honorable Minister Aisha Sechindi. She has a representative, so we'll hear from her after we take this comment.
Thank you. Tembo Mujungu, Songora South. I want to thank Richehan and the panelists for productive conversation. But away from the difficulties on the islands and the water bodies like Lake Victoria, and the chilling story we heard about the drowning in Lake Bunyonyi, I wanted to interest the House to drowning on rivers, untold stories. Of course, I'm cognizant of my brother Kwesi on Great Lakes. Many of you have heard of River Nyamwamba, the famous river with floods, where I come from. Nyamwamba claims 2 or more people every rainy season due to drowning. And I've listened to the commissioner. They seem to be focusing on the larger water bodies in terms of policy framework. We need to address ourselves also on the small rivers across the country. Just to share a small story, when about 40 years ago, when I was still young, my uncle was taken by River Nyamwamba. He used to live across the river, and the Chibanja, where he was collecting food, was across the river, opposite side. So in the evening, with his the son, they were carrying their foodstuffs to the family, and the mzee was taken by the water. Following morning, we heard the man had died. And traditionally then, when you drown, you are not buried in your compound, according to the people from where I come. You are buried along the river. And with the insistent floods now, we can't trace even the bones of my uncle. But what I want also to interest ourselves to, when one drowns, what happens to the family? Yes, what happens to the family? In my situation, my father had to take over the family. So what policy guidelines are we going to get in that direction? The head of the families has drowned. What happens? 2, I think we need to sensitize communities along these streams. How we may not give them life jackets, but how do they respond to seasonal floods? Sometimes the water will find you in the middle of the river as you seek to cross the huge stream coming downstream. And off it takes you. Secondly, when Canary said he was told the jackets were not up to standard, Minister of Works and Water, what are we saying here? Who should ensure that the jacket is up to the standard? The regulation. How do we import substandard life jackets? And yet wanted to save the people. So if you're talking about safety, then it should also be safety at import point. This is also equally important. So I thought we should share this as well. But otherwise, we need to do a lot on the policy, but also implementation. I agree with my sister. The documents are good as they have been designed, but at implementation, that's where could be the question. Thank you.
Thank you very much for that. And I believe our organizations are actually on the ground. We're working with the ministries, and there's already work that's being done, and I'm sure Belinda can attest to that. Of course, there's much more that can be done, but what's very important in a journey of 1,000 miles is taking that first step. So we would like to close. I want to thank you for your patience. We're going to hear from the representative from the Minister of State. But let's first give a round of applause to our panelists so they can have their seats.
I just wanted to say that just a few days after New Year's, I lost a friend. He was a journalist with Daily Monitor, 45 years of age. He died due to drowning. The wife was driving with 2 children in, and himself. He's always had phobia for water. So when the car got off the road, it fell in a swamp along Kalagala. When it fell in the swamp, the 2 children survived. The wife, who was the driver, survived, but he died because I think because of the crash, he panicked and he died, he succumbed to drowning. You can imagine. So I think goes to what Honorable was saying, what happens to the family. Yeah. Just wanted to.
Thank you, Kanari. Thank you, our dear panelists. And I'm sure we had a rapporteur today, so a lot of these comments are going to be noted, and we're going to work with them, with our working groups and forums that are dealing with drowning prevention. So thank you very much. Thank you, Commissioner. Thank you. All right. So we wanted to hear from the Commissioner, Mr. Zije Charles. I don't know if you would have other comments after what you shared. We had planned to invite you here to kind of give, maybe let's say your commitment from the ministry, but you shared much on that, but would still like to hear from you. And also we'll close with Engineer Christopher Tumusime. He's a Commissioner for Water Utilities Regulations Department. He's here on behalf of the Honorable Aisha Sekindi, the Minister of State for Water, Ministry of Water and Environment. So allow me first to welcome Commissioner Commissioner Charles to the front, then we can invite our chief guest after that. Thank you.
Thank you very much. I think I had already mentioned a number of issues about our interventions as a ministry. But as a wrap-up, I'd like to take this opportunity, first of all, to thank the organizers and the panelists for their questions and for having been able to answer the questions from the public. The Minister of Works and Transport, as I had told you, is responsible for regulating water transport. And as I had told you, we have in place a law, which is the Inland Water Transport Act, that guides this regulation. The Inland Water Transport Act deals with the regulation of safety of navigation, safety of water, inland waterways. It deals with safety of the vessels when they are traveling. And it also deals with security where on the inland waterways. And then finally, it regulates the prevention of pollution from maritime. And as a ministry, we have put in place a number of interventions, and we are continuing to put. But the most hindering thing that has been actually delaying us is the regulations which are supposed to support this Inland Water Transport Act in order to allow enforcement. But before I go that further, drowning as a problem in the country is multifaceted. It touches everywhere. Drowning happens in homes, in swimming pools. Drowning happens in swamps, in rivers. Drowning happens even in buckets or basins. People have talked about it, where children have what? Drowned in basins and containers. Even in farms. So the law or the strategy to regulate or to combat this problem should be really a concerted effort. It cuts across so many ministries. And the civil society also, we call upon them to do what? To put in their efforts to make sure that whatever the government is doing, they support us in terms of disseminating information and also providing the what? The necessary support. The Honorable from Kasese has talked of the standard of life jackets. Who is responsible for this? Definitely we as a ministry, we are supposed to come out with the regulations and the standards of these life jackets. But we have the National Bureau of Standards also we work with to make sure that whatever the standard of a life jacket is actually, for us, we recommend the ISO certified life jackets internationally. If a life jacket is not ISO certified, then it is substandard. But you know, in our country, people will always sneak in substandard products. It is happening in all forms, whether whether clothes, whether electronics or anything. Substandard products will always sneak into the country. But we have our recommended standards for these life jackets. Because it is a life-saving equipment, there is no way it can be substandard. So the enforcement, who is our Marine Police? Marine Police is responsible for the enforcement of the marine regulations. They should always check out on these safety equipments. They should always check out on some of the safety provisions we have put in place. Because for us as a ministry and a department, we cannot be everywhere. The only interventions we are doing related to that is carrying out safety campaigns, which we are doing with the CAA, which we are doing with the Ministry of Water, going all around these islands and water bodies to inform people that for you to be safe on these waters, please put on a life jacket and let it be what? To the required standard. In some places we have gathered information and we know which areas of which seasons or months of the year where the waters become so rough that we put out notices for people to be what? Careful in terms of loading their vessels, in terms of the times of travel, and in terms of, being more strict to safety measures. Because the lake or the rivers decide to become rough in given months. And that's where we see high influxes of what? Of death, incidences of drowning. And the police knows this, and our people know it. We communicate, we put in newspapers, we carry out safety campaigns on radios, on TVs, to inform people that the month of June, the month of May, and July are bad months. The waters are rough. That is on Lake Victoria. But also on other water bodies, like Albert, other water bodies, like Edward and Choga, we carry out these programs, and we go there. So, members, we have started a journey together. It's a big journey. Because we are not alone. Let me tell you, we may think Uganda is very behind, but we have traveled to other countries. The emphasis has always been put on high seas. And the small rivers and water bodies, there has not been much emphasis. And I also need to share with you that the funding, the budget allocated to marine is too small. The government has not prioritized here in Uganda the sector of maritime transport or maritime, which also hinders our progress in terms of addressing some of these issues. So, the honorable members who understand that we need to come up and make these interventions, I think they should help support the expanding of the budget for the maritime, so that these activities can be done together with the enforcement bodies, together with the other stakeholders who are responsible for these water bodies. Now that you have met today, we need to see how to progress from here. Drowning is a very, very big problem. It is killing a lot of people. So how are we tackling it together? Let us make resolutions. We make steps on how to continue meeting to address these issues. I think if we work together, we shall achieve more. So with these few remarks, of course, the interventions I cannot go into. The project is too huge, and the other interventions are many. This is not a platform to address some of these things. But now that we have met, if we can continue meeting, these issues should be very clear to you. The Ministry of Works and Transport, and particularly the Department of Maritime Administration, is open to you. For those, especially the journalists, the investigative canary, if you could come around, you can enrich this documentary and have a next phase of the same documentary. This was focusing one area, but we can look at other areas so that this is shared, and once it is shared, it brings out a national picture on what is happening on our water bodies. So I want to thank you, members, and thank you for giving this opportunity to talk to you. Thank you.
Thank you very much. Without further ado, I'd like to invite Engineer Christopher Tomusime. He's a Commissioner, Water Utilities Regulations Department, and our chief guests. Please, a round of applause.
Good morning to you all. Good morning to you all. I introduce myself once again, Engineer Christopher Tumsime, the Commissioner for Regulation in the Ministry of Water. I have to apologize, I didn't watch the film because I had reached Ruzira, and getting back from Ruzira into town is another problem. But I was not supposed to be here. It was supposed to be the Minister of State for Water who called me and said, please go and represent me at this most important function where she should have been, because one of the ministers is out of the country and the remaining two, and quite a number of issues came up. So she sends in apologies, and she said one of the things that she would have wanted to share with you, her life in the early ages on River Katonga, where she was doing alternative livelihoods around her home, and experiences on River Katonga and how they do all those issues that we talk about. Drowning, she said, no, drowning, you can even drown in a swimming pool. So he said, I would have been very much happy to be part of you. Also that her experience in Karangala and how she used to move up and down on the islands. So myself, I don't know how to swim canary. I heard you asking that question, so I also don't know how to swim. So I'm going to read her statement as she gave it to me, because it was supposed to be a function, it was not supposed to be my function. Honorable colleague members of Parliament present, district chairpersons and staff of district local governments, heads of central government departments, representatives of NGOs and CSOs, members of the press, online, print, and audio, especially Sauti Plus,
members of the Uganda Police, especially the Marine, distinguished guests, ladies and gentlemen, good morning to you all. It is a great honor and pleasure to be part of this event as we launch this important documentary on drowning prevention. Before that, I have to mention that, interestingly, Commissioner Sowed called the whole meeting of the ministry to tell us about drowning prevention strategy. Then we're talking about drowning prevention, because I think when you are not aware, at the beginning when he was introducing the subject, quite a few people could understand. They were just saying, why is you taking us about drowning? But towards the end, it became something that everybody was trying to buy in. So I go back to the minister's speech. This moment is not just about showcasing a film, but it is about taking a critical step towards addressing a growing but preventable crisis affecting our lakeside communities and beyond. Ladies and gentlemen, Uganda is blessed with abundance of water bodies. However, this blessing comes with significant risk, drowning. Each year, we lose too far many lives, especially among children and young people, due to lack of awareness, inadequate safety measures, and limited access to swimming instruction. Despite frequently facing dangerous conditions on large water bodies like Lake Victoria, fishermen cannot swim. I'm informed that in 2023 alone, 138 drowning fatalities were reported, a fact that underscores the urgent need for strategic intervention to prevent drowning. The documentary we are launching today highlights the realities of drowning in Uganda, particularly in our island and lakeside communities. It sheds light on the challenges and the most vulnerable face and presents practical, community-driven solutions that can save lives. Through real-life stories and expert insights, this documentary serves as a call to action for all of us, the key players in drowning prevention, including government agencies, development partners, civil society organizations, and communities. This documentary is part of our strategy to create awareness on drowning prevention, and I do hope that it has generated a lot of anxiety and resolve to even bring it immediately to the public. As the Minister of Water and Environment, we are committed to strengthening water safety policies and collaborating with stakeholders to ensure that drowning prevention becomes a national priority. In partnership with organizations in water sector and academia, we are proud to be part of the efforts to develop Uganda's first ever national water safety drowning prevention strategy, which will be launched during the Water and Environment Week in March 2025. And specifically, that is the week of 21st, 22nd, 23rd. The strategy will provide a framework for reducing drowning incidents through policy, education, infrastructure, and community engagement. We're also working on improving access to safe water activities by supporting initiatives such as survival swimming training, school-based water safety education, and community engagement programs. Additionally, we recognize the importance of equipping communities with life-saving equipment and training first responders in emergency response techniques. The documentary we are launching today aligns with the strategic interventions that have been identified in the strategy. After watching this documentary, let it serve as a reminder that each one of us has a role to play in drowning prevention. Parents, teachers, community leaders, policymakers, and development partners must all come together to create safer waters for our people. Prevention starts with awareness, education, and action. Let us use this documentary in communities that are most affected by the drowning as a tool to start conversation on drowning prevention and create awareness on the same. As I conclude, I would extend my sincere appreciation to all stakeholders involved in drowning prevention. My special thanks will go to Bloomberg Philanthropies, Reach a Hand Uganda, Design Without Borders, Global Health Advocacy Incubator, Makerere University School of Public Health, for their support for addressing the drowning challenge in our country through documentary. I would like to thank my colleague members of parliament for attending and going to represent this at a higher level of government. I thank Kanare Mugume for spearheading this documentary. I call upon all of us to use this moment to drive the real change. We must work together to ensure that no more lives are lost to preventable drowning incidents. And remember, anyone can drown, but no one should. With these remarks, it is my distinct honor to officially launch the drowning documentary. There is a dash. I don't know whether she says there is something to cut or something like that. I now declare it officially launched. For God and my country, Honorable Aisha Sechindi, Minister of State for Water. Thank you very much, colleagues, for attending. And also the little bit I have heard from the meeting, it is something that we need to, and from what I heard from Commissioner Sowed, what he brought to us at the office, it is something that we need to bring to the general public. Thank you very much.
Thank you, Commissioner. Our rallying call remains. Anyone can? All right, let's say it together from the start. Anyone can drown. No one should. Thank you. So I'm going to invite Maki, my colleague from Sauti Plus Media Hub. We want to take a group photo. So Commissioner, if you join us. Engineer Christopher, Mr. Ruzijek, please join us. Dr. Enid, our partners, the Maritime Police, please join us. We'll just get a group photo over here. I'd like to recognize the CEO, Reach a Hand Uganda. He's been here from the start, but I know there's a lot of things he's doing back there. I don't know if he's here with us. Yeah, we can have a group photo here. Country Director, Reach a Hand Uganda. We'll just get on the platform. If you still do have your comments, please share them either with me. There was a lady taking around the mic. We want to put them together. Just here, please. Yes. Just no, up. Yes. Design Without Borders, please. Our partners, if you're here, please join us. Dr. Oporia would also love to have you join the team up here. I hope there's no one I've left out. The honorable, do we still have some honorable MPs? I know they had to rush out for a meeting, but if you're here, Canary, the man of the hour. Oh, I'm sorry, I had not called you. Okay. And would request us to stay behind. The media would also still like to talk to us. Representatives from the district, Mayuge, Masaka, Raka, if you're here, please join us. Yeah, let's smile. I know a rallying call doesn't end up in a smile. I want to also thank the members of the Fourth Estate for being here with us. You're going to play a big part in getting this story out there. And just to reassure all of us, a documentary is going to be translated. We are going to go and screen them in the local communities that are affected. So this is just a start. This is just what we will use in the communities to provoke those conversations, conversation starters on the real problem on the ground. Thank you very much.
They have not been left the same. Swipe here was a survivor years ago, but the memory of his colleagues drowning while he was in the same boat have not left him the same.
Nali nkuteeka ddumula nga kenkute n'enkuba enduulu kati waliwo abaali bali kuyita kumpi awo nabo ne bagira ki ne bansanga busanzi ne bantwala kutale.
His experience on the lake has forced him to change livelihood from being a fisherman to goat farming.
Nze ebyokuvuba nabivaako kati mpe alisaawa dino enanda tigitwala ng'ekintu ekikulu ino. Njiriku aye tigitwala kugamba ng'obuvubi nga tiringa muvubi ino okusinziira ku kikanga bwekyo.
Swibe is among the 282 people living here on Simwe Island, Mayuge district. 282 is a number that dwindles with every life lost to the lake. Here, time moves differently. Medical supplies can take even months to arrive, and emergencies depend on the mercy of the weather.
Well, it's the weather that determines when to leave and when to move. So now we have to go.
These waters, vital as they are, have become a death